So yeah, this week we are going to start with P wave, and then we are going to continue to PR interval. So like you guys know, like I told you that P wave stands for what? What did I say P wave stands for? Everybody in the class. P wave stands for what?
HR depolarization.
Okay. Is that the only person in the class?
HR depolarization.
So now basically what you just need to know about this period. So yeah, we're going to be talking about the durations of each of this wave and also the clinical correlation. If it's too wide, what does it mean? If it's too tall, what does it mean? If it's too short, what does it mean? And stuff like that. Now for P wave, right? What you need to know about P wave is that a normal P wave is 2 points is wider. The is it the width or something? The wideness, yeah, is three small squares. As you can see here, this wideness is three small squares, and then the height is 2.5 small squares. That is a normal P wave. It is what? Wide by three
Normal
small
period.
squares. Yeah. It is wide by three small squares and tall by 2.5 small squares. And I also have told you this before that P wave is always positive in lead 1 and 2 in NSR means normal sinus reading. So P wave is always positive in lead 1 and 2 in normal sinus reading. It's usually negative in AVR and biphasic in lead 1. Okay. So now, as I said before, the normal P wave is wide. The wideness is three small squares and then the tallness is 2.5 small squares. Now what happens if the P wave is too wide, if it's too tall? Now there's something we call P pulmonale. P pulmonale simply means that a tall P wave. That is P pulmonale. So if your P wave is taller than 2.5 small squares, the ECG machine is going to record P pulmonale for you. That's what you're going to see there. Okay. And it is usually due to enlarged right atrium. That's just what causes it. When your right atrium is enlarged, and since it's even atrial depolarization, know that if anything is wrong with your P wave, it is your atrium that is having fault. The problem is coming from your atrium, right? So, P pulmonale as what? It is tall P wave when it is taller than 2.5 small squares. And also, when it is usually due to enlarged right atrium associated with congenital heart disease. All those things did not really concern you. But what you just have to know is that P pulmonale has to do with tall P wave and what? It is caused by enlarged right atrium. Now, this biphasic P wave, it is not that something is wrong, right? When the P wave is biphasic, and I'll not want this to confuse you, okay? Because there are some times that biphasic period used to be wider, right? It used to be wider than the normal three small squares. And if it's actually wider, it is P mitral. So I would not want to confuse you with the biphasic because biphasic P wave is actually normal in leads like lead one, like I told you. Sorry, V1. So I don't want to confuse you guys with this biphasic P wave. So now moving to P mitral. The most common ones are just P mitral and then P pulmonale. So this P mitral, it is wide P wave, opposite of P pulmonale. Okay, and it may be due to mitral stenosis. Mitral stenosis will mean when there is narrowing in the mitral valve. Okay, restricting blood flow from the left atrium to the left ventricle. I'm coming. It is in this part of your note. That this thing has covered it. Let me open it again. Yeah. So okay, yeah. P mitral. Yeah. Mitral stenosis is what? It is narrowing of the P wave. Sorry, of the mitral valve. And then the effect is that it actually restricts blood flow from the left atrium to the left ventricle. So when there's mitral stenosis, what you usually see is what? Is the P mitral, a wide P wave, wider than three small squares. And it's due to mitral stenosis or left atrial enlargement. P pulmonale is due to what? Right atrial enlargement. P mitral is due to mitral stenosis or left atrial enlargement. P pulmonale is tall P wave. P mitral is what? Wide P wave. So that's just everything you actually need to know about P wave. So let's look at. I have some images of the list. Can you guys hear me? Do you understand everything I've said so far? Do you have any
Yes, ma'am.
questions?
Yes, ma.
All right. So identifying these leads are not really hard. That's why I had to, take it from the basics so that you'll be able to understand when we move further, like we are now. So, P pulmonale. This thing is not really wide. Another thing you need to know is that the best lead to look for P wave is your lead two. The best lead to look for your P wave is what? Lead two. You see, as we continue, I'm going to be telling you the best lead to look for this lead so that you not just be stressing yourself looking through the old 12 leads. The best lead to look for a P wave is your lead two. PR interval also lead two. Okay, so now let's look at this. This is lead one, two, three. Let's look at this lead two now. If you can see clearly, you see that if we are counting this P wave, it is one, two, three, four. Because it is this thing, that's why it's not really clear. But if you see what I'm trying to say very well, see that this one is two, this one is two, that is already four. Can you guys see what I'm trying to show you?
Ma'am, please, can you please come again?
Okay, let me come again. Look at this P wave that my arrow is on. If you count the small boxes in the length, this is one, this is two, this is three, and then this is four. This is because this is not is kind of blurry because of the image. We are viewing it from image. But if you actually see it, you'll be able to count these tiny boxes very well. But mere looking at this thing, this is two small boxes here before this arrow and before this line. And then after the line, there are also about two to three small boxes. That's already like four small boxes. I'm saying it must not be taller than what? 2.5 small boxes. So you have P pulmonale in this lead. Do you understand?
Yes, ma'am. Yes, ma'am.
Let's look at this now. Coming. Yeah. Looking at this lead now, this is I think one, two, three, slightly like three and a half. And it is more than the normal 2.5 small boxes.
Wait, sorry, is this is 2.5 now, Abby?
No, it's not.
From our end, they look like 2.5.
For my own side, looking like three. It's actually three because this is one, two, and then this is three. This is what I counted. One,
But
two, and
yes, the third one is not touching the, but it's fine.
so this is three small boxes. Some people monos, that's why you have to like look really well when you are seeing the strip because some of them will actually look like they are like 2.5, whereas there are even three small boxes. Another thing is that some of them will like be pronounced that you see the P wave that is actually very tall. But I don't think I actually be tall to like up to half of the QRS complex. But then P wave is just very small, just three small boxes. I sorry, 2.5 small boxes the length. So it's actually easy to to decipher. And okay, this is P mitral. Okay, yeah, let's do P mitral. For P mitral, most times you're going to see something like an M. If you check this place, you will see that there's something like M in this. Can you guys see what I'm trying to show you? This M like lead,
Yes,
this M
yes.
like wave. Now, if you check this place, you can see the same thing repeating itself here. Look at this place now. Look at this place. Look at this place. Look at this. You can see that it is. Look at another one here before the QRS. So it's looking like multiple P waves. Mm? But it's not really multiple, it's just like a an elongation of the P waves. So that's what we call P mitral. Because if you are counting this one now, it should be up to like 4 to 5 small boxes. Okay. So when you see something like this, on the P wave, you can deduce that it is what? P mitral. Let me see if I have another image. Oh, okay. No, that's the one I have. So do you guys understand?
Yes, ma'am. Yes, ma'am.
Alright, thank you. So now moving to this spear, I want you guys to pay.
No, it's already 10 minutes.
Okay, yeah, let me